So I'm so glad to see such a good turnout here. It's amazing the number of people that are interested in learning more about homelessness and what's going on in the community. And it's not just the Whittier community, it's the community at large. It's all over Southern California. We have a lot of people that are homeless. So I'm the Director of Care Management at PIH in Whittier, and I can tell you that we see a lot of people that are homeless. They come in, they're very broken people. So, our goal always at PIH with any patient is to put the patient first. And so in putting the patient first, we have to get to know who they are. And we provide them with care, and then we try to make their transition easy. So, our volume of homeless has gone up throughout the last 2 years. We're seeing a lot of elderly homeless people now. They're walking in off the streets and asking us to help them. We're also seeing a lot of families. So we work very much in collaboration with a lot of different county agencies. We work with First Day. We have a really good working relationship with Ted and the group that he has over there managing First Day. And then also with the Illumination Foundation. They came in about, I think it's a year ago, Julia, and they've been taking our medically compromised patients that need home care. They may need PT. We do have a contract with First Day, and we do pay for them to go over there. So, as a hospital, we feel like they come to us, they're in need, and we want to provide them with the care that they need. So there's no discrimination against them. I mean, they're treated with respect and dignity. We have clothes in the ED to provide them with clothes, underwear, soap, shoes. And I can tell you, I was amazed. I need to tell you a little story about one of our nurses. We had a gentleman that came in. He was an alcoholic, really had been out in the streets for days and just, filthy dirty. And, she came down, and we were trying to get him over to the Illumination Foundation. But, of course, we didn't want to send him over there, not smelling good and just filthy. So she actually came down, and we put a team together and cleaned him up and bathed him. And they cut his hair also, and he was so grateful for that. The gentleman told us finally that he had not had a bath in several months. So he was very grateful to be bathed. And they did it with such compassion and caring. And this is what this patient population needs is, care and compassion and understanding, because there's not a whole lot of difference between, us and them. They're human beings, and, any of us could end up out on the streets. The gentleman that was just up on stage, kind of alluded to that. He had a house and a family, and, anything can happen to a person that could cause them to be homeless. So, we need to treat the people with very much respect and give them dignity, and they're no different than any of us. So if you're interested in getting involved in working with homeless patients, I know that there's a lot of community support and agencies that are looking for volunteers to help out. We could also use help at the hospital folding clothes that we get. We order clothes, and we have to fold all the clothes that come in. So if anybody's interested in coming over and helping us fold clothes.
And so the MITS team is going to be doing something called, an evidence-based practice is called critical time intervention. And it's kind of outreach and then following up with people who are very, very, very vulnerable to try to get them into at least temporary housing originally, and then more permanent housing, and they actually have housing dollars as well. So they have outreach dollars and housing dollars. So that's coming your way, it's just getting signed now, so that's going to happen very soon. The next one is Laura's Law. Some of you may have heard of Laura's Laws. We call it assisted outpatient treatment, and that's for people who don't realize that they're ill and so don't accept treatment. Sometimes you can go through that Laura's Law. There are a lot of conditions. It's very, very much designed to safeguard the rights, civil rights of people. But nevertheless, if somebody is really on the verge of, deteriorating to the point of endangering their life and their health, you might be able to go through the courts to encourage treatment through the courts. So that's the Laura's Law. There's two more, and then I'll stop. Law enforcement teams are what the captain was talking about, that we're going to maybe have here in Whittier. And I'm really excited about that. That would be a ride-along, basically. It'll be a police car and a police person with a mental health person, and they'd be teams. And so if there's a mental health emergency, you could call out that team, and they would be able to handle it together, and hopefully very effectively. I have here, I want George to raise your hand. You raise your hand. There's George. George is my new manager for our SB82 team. You all need to know about the SB82 team. This is grant dollars, actually, that came to us from the state. Every service area now has an SB82 team, and the team consists of 4 people who have lived experience, either homeless or mentally ill, and 4 people who are clinical people. And we're going out there, and we will reach out to anybody that you call us to reach out to. It's very open, no real conditions other. The person's homeless, and we think they have a mental illness. We'll come out and we'll do everything we can to get them into a shelter, into permanent housing, and with mental health assistance. Okay, and then the last one I want to talk about is the Valors and Loved Ones Recovery, the Valor program. That's a program for veterans. So if you know of people who are veterans and they need assistance with housing and or mental health, we also have an outreach team that consists of employees of the department who are also veterans. And they hopefully can reach these people in a peer type of way and help them with housing and mental health services. So lots and lots of outreach stuff. We'd like to do more. I think that this is the future, actually. So I hope that you will support us and support our team with George. And he has about 300 cards here with him, so I saw a big pile. One more thing. I put out some brochures here. So this is a home walk happening for people who are advocates of people who are homeless. So you might want to look at that. This is our Service Area 7 brochure. Kind of shows you all the different kinds of outpatient services that we have. This is on the mobile SB82 team, which I just mentioned. Very important team. Oh, and this is home. Oh, and then we have a clergy. Sorry, where's my clergy thing? There's a brochure out there. It's a clergy outreach. So if you know, for those of you that are here from churches and synagogues and faith-based things, please come to our clergy breakfast mixer. We're going to have like an hour of talking about what my service area team can do to help the churches and the clergy when they need assistance with one of their constituents. So that's happening on the 14th, which is Wednesday, at Helpline in Whittier. So that's it. Thank you.
Thank you. And can those information, we have a resource table. A lot of our resources are for you to take, and they're over here on this table. So when you leave, all of these resources are available to you. Thank you. Next up, we have from Licata, Juan.
Hi, good afternoon. I'm Juan Navarro with LA Centers for Alcohol and Drug Abuse. We have a center in Santa Fe Springs where we actually provide residential services for people that are dealing with drug addiction or alcoholism. What we're finding at our agency is that at least 80 to 90% of the people that come through technically are homeless. Our agency focuses on providing services for the addiction, but we're also finding ourselves in assisting in helping them find housing. So on our end, that's one of the biggest challenges we encounter. The program normally is 5 to 6 months. What we're finding is that now, because our clients are unable to find housing, they actually end up staying in our facility for at times up to a year. Our goal as an agency is to assist them in providing, in securing housing, employment, and I'm a little bit nervous, but basically we want to provide a permanent solution to the problem. What we're finding is if we can deal with the substance abuse and we can deal with the addiction, then most likely this person is going to become a productive member of society. That's what we're looking for. I brought information, it's out on the table. the agency's been around since 1971. We focus mainly in the areas of Santa Fe Springs, Whittier, and Norwalk. With that said, I don't know if there's any questions or...
We'll open it up. Questions for all three of the panels is, these are our local healthcare providers, and so if you guys have any questions for them, just raise your hand and I'll walk around the room. I haven't been on that side in a while. I know PIH, I know that you guys have set up a clinic in First Day, and I don't know if that's something that you want to expound upon, because I didn't know that existed until I went to First Day. So if you can explain that.
Yeah, so we do have a clinic at First Day. Unfortunately, I think our funding for our nurse practitioner was somewhat cut. So now we have our family practice residents that are covering the clinics. And we're looking at the, what is the outcome of not having the nurse practitioner over there, because we are seeing more homeless people now coming to the emergency room. So it increases the volume there. In our ED, we probably see anywhere from probably 200 to 250 a day. So any given morning, I can tell you we walk in there and there's probably about 4 or 5 mental health patients waiting in the ED for placement. So it has affected the hospital. So, with that being said, I know that our CEO, Jim West, is looking at that. And, we may end up having to, have the nurse practitioner back over at First Day or work out a different solution. So, anyway, that's what's going on at this point in time. Family practice is covering.
Thank you.
Excuse me. My name is Rita Murray, and I'm with National Alliance on Mental Illness here in Whittier. One of the things I want to address is the use of language, and it's been like nails on a chalkboard all day. And I talked to several of you folks, and you believe the same thing. We do not call people the homeless or the mentally ill. They are a person who has a mental illness or a person who is homeless. And I know it took me a long time to change my language. So if you make a mistake, nobody's going to jump down your throat, but try to change your language over time, because it does change how you look at an individual as a person instead of a problem. And I also, I see Ana Suarez a lot because I go to the service area meetings, but I wanted to ask Presbyterian, years ago you had a psych unit and you had a substance abuse unit. Families that I hear from, there are no beds available. And if there's no beds available, the crisis teams can't come out because they would be liable if they can't place people. Families have their loved ones waiting in the emergency room for placement somewhere else for days sometimes. One family member had her loved one in an ER, not yours, for 15 days waiting for placement. And from what we hear, the reason hospitals don't do psych units is because there's no fancy tests that you can bill for. And so it's not cost effective for hospitals, but it certainly is something that we need. There's only one psych hospital in Service Area 7, I believe, and they're always full. They do have law enforcement beds, but quite often they're full too. So I would urge Presbyterian and the board to consider adding more services as far as units. And the other thing that it was a contractor that provided those services, and she used to organize breakfasts so that all the mental health providers could meet just to talk about the programs they have, and it was very effective, I thought. And just encourage.
Well, that's something I'll take back to Jim West and relay that information to him. I know it's very hard to get patients placed. Typically we don't keep them in the ED longer than 48 hours. If we can't get them placed in that time period, we'll go ahead and put them in a bed upstairs and then work on getting placement. We do have several contracts for people that are uninsured with 3 different hospitals. Of course, 2 of those hospitals are out of this area, and we don't really like to send patients away from the area if we can avoid doing that. But the beds are very tight. The need is large, and the beds are very few. So, but thank you for that feedback.